So here is part 2 of when you should build a portfolio during medical school. I released part 1 yesterday, go check it out. The second point I want to make is that, again, someone correct me if I'm wrong, but I think it's a huge misconception that if you wait till clinical school, you'll suddenly know what specialty you want to do. Now, I understand the thinking is that once you get more clinical exposure, you'll have a better idea of what you like and don't like, and that's fair. But I will say it's very different being a medical student on placement in a specialty to being a doctor. And additionally, it's different being a foundation doctor to a core trainee, to a higher trainee, and certainly to consultancy. Because as a medical student, you do not have any responsibility for your patients. I have also been told by my seniors that the jobs that you do during foundation training are also not necessarily reflective of what it's like to work in that specialty long-term as a registrar and a consultant. This is to say, I don't know when people decide that a specialty is for them or isn't, and I don't know how they make that choice. I've known people who have gotten into training and then dropped out later because they've changed their minds and they've swapped to a different training program. People also take years out to explore different specialty interests through pursuing clinical teaching or research fellowships, and they use that time to build portfolio points too. This is all to say that I don't think it matters if you pick a direction during med school and then later change your mind. And even if you don't know what direction to pick, if you spend your free time during first year or second year of medical school just attending events, just to engage with different specialties and to explore your interests, that is still a worthwhile investment of your free time. It's easier to do clinical projects such as audits and quips during clinical school, sure, because then you're on the wards interacting with doctors, and that's where these opportunities come from. But you can still do things during pre-clin. You can spend your 3-4 month long summer holidays doing summer research placements in labs and picking up wet lab skills, dry lab skills that are useful later down the line if you want to do a master's or at some point a PhD like I did. You can join societies and attend conferences, you can lead societies, you can run conferences. These are all things you can still do during preclinical school. It's just the way that I was brought up, the friends that I was surrounded by, the sixth form that I went to, shout out to HBS, we're all quite proactive people. I believe in creating opportunities for myself and making sure that I have as many doors open as I can for my future. Yes, you can get through medical school with nothing but your medical degree at the end, and after F2 you will probably get a job somewhere in the country if you don't care what specialty you work in or where you work. You can of course take years out after F2 to explore specialty interests if there are CTF, research fellow and trust grade jobs available. But if you want to go straight into training after F2, if you want to work in a competitive specialty or a competitive location, I would start thinking about it now.